Emnet, what have you been doing for quarantine?
I figured out we have roof access, so we've had a lot of me and my roommate has had a lot of like roof time and like lounging and like coloring, which has been really fun.
That's awesome. I've been doing nothing. I've been working long hours, and then all I have the energy to do is like watch TV.
I think that's perfectly valid. That's the rest of my schedule. So
Yeah. Like screen time with more screen time.
yeah.
All right, it's 11 a.m. So I think we're gonna get started. All right, so hi everyone. I'm Madeliene Hernandez. I'm a board member with Young Women Empowered and today's panel moderator. Welcome to the Why We Alum panel exploring the impact of COVID-19. If you're new to Why We are a nonprofit located in Beacon Hill in Seattle, Washington, serving young women in the Puget Sound area. Our mission is to cultivate the power of young, diverse women to be creative leaders and courageous change makers through transformative programs within a collaborative community of belonging. We envision a society rooted in social justice where all young women live their truth, achieve their dreams, and change our world. We do this by offering after school and summer programs where we focus on empowering youth so that they can be leaders in their families and communities. If you are already part of the Why We community, you know how magical it is, and we hope that you get a sense of that through this panel today. So over the past few years, Why We has held a career day that is open for all youth to attend. And at that event, we have highlighted the careers of different women of color to hear about their paths and their struggles to get there. And I think it was a really great opportunity for youth to be able to see themselves in different careers that they might have not otherwise thought of. I'd like to thank our sponsors like Niantic, Kaiser Permanente, Best Arts for Kids, and the City of Seattle. Unfortunately, as you know, we can't host this event in person, so we're having this panel as an opportunity for us to hear from some of our amazing alum about their perspective on the impacts of COVID-19, what they think we can take action on to make sure that we're uplifting the community needs that are out there, as well as how the Why We community can position itself as a leader during this time. During the panel, we invite you to submit questions via the chat box that we'll answer during the Q&A. So without further ado, let's meet our panel. Super excited to have you all here today. So the question is, can you please share your name, your pronouns, what programs you participated in at Why We and for how many years, as well as where are you located in the world right now? Nasra, do you want to start?
Yeah, sure. I'm Nasra. I use she, her pronouns. I've been involved with Why We for about 3 or 4 years, and I've done Why We Write, Why We Lead, and I've been on the Youth Leadership Council. I live in Shoreline, so that's like North Seattle area. Yeah.
Thank you. Iman or Emnet?
Yeah, I can go. My name is Iman. I use she, her pronouns, and I've done YW for 3 to 4 years as well. Started back in 2011, I think, and took a break and came back for YW alum. And I'm located in Seattle, Washington.
Hi everyone, my name is Emnet. My pronouns are she and her. I grew up in Redmond, East Side. If that's still not cool, that's okay. But I am right now. I'm in Brooklyn, New York, and I was in YB for 5 years. I did YB write, lead, create, and speak.
Great. Welcome, and thanks so much for taking your Saturday to do this with us and share with the Why We community. So let's get into this conversation. So given your personal experience and perspective, what do you think our communities need right now in order to successfully navigate COVID-19? And whoever wants to jump in first is welcome to.
I can start. I think Personally, I think what our communities need most right now, and even beyond the pandemic, is statewide support in gaining legislation to give tenants some sort of control over their living situation. And I've noticed, and I've personally dealt with landlords who have immense power in dealing with their tenants. And I think that this pandemic has really highlighted a lack of empathy within those circles. I think I've read that the government has included a piece of legislation in Governor Inslee's extension of the eviction moratorium that doesn't allow landlords to raise rent prices. And I think that's some incredible progress that I don't think should be a temporary form of relief. So especially right now in such an unforeseeable time, I think that we really need to be going for the jugular when it comes to making these amendments permanent. And that could be anything from calling your senators and representatives or email, letters, carrier pigeon, what have you, just, really cracking down on local and federal leadership, whatever avenue you may take to accomplish that. So.
Absolutely. Iman or Emnet?
I can go. I think because like I work in media, so um, most of my focus is usually on how important information is. So I really believe that our state officials, our city officials should be thinking about how different communities have different communication methods. Not everyone consumes information the same way. And that for like just doing a press release or doing a press conference once, that's not enough. Certain communities don't have access to television to even watch those press conferences. So I think, especially in a time like this, that like COVID-19 has done an amazing job at highlighting the inequities that already exist within our institutions. And one of them is how information is being passed down. And number one is don't listen to our president because he is not a doctor and he gives horrible advice. But on that note, I feel like information is very important, especially what my community needs, like translation of resources, having press releases translated into different languages or subtitles, or even having some sort of like giving grants to organizations to hold those smaller community kind of Zoom events to pass down those information. I know a lot of nonprofit organizations are already doing this amazing work, but they need the resources to help them do that work. So if the official and like the officials in the city and the state cannot do it themselves, I believe that they should be putting the money behind those organizations that are already doing that work. So yeah.
Yeah, and there's so much information out there. Like I can't even
Yeah.
imagine being in a position where, I don't know the language or I don't know where to get the resources. So yeah, for sure. Emnet, what are your thoughts? Oh, you're on mute.
I'm sorry. I said I agree with both of y'all. That's super real. I think our people need access also. We need access to like whatever little social policy safety nets we have. I know there's like parts of the CARE Act that like added $600 to unemployment, or added, or like SNAP is allowing everyone to get the full amount of $600 for the next 2 months. But I think it's super important that we push our leaders and our politicians and our policymakers to make sure that that's something that lasts past those 2 months, past the 6 months. And I think we need to also realize that like these stimulus checks, this $1,200 is not equitable. There's a lot of people that aren't getting their checks. There's a lot of people that are like undocumented. I think California is the only state that has a budget for undocumented people. And I think people are only allowed like $500 each as adults, and there's nothing available for people with children. So I think we really need to make sure that when we need to get our money, and we really need to make sure that our policymakers are having like an equitable like lens when they're making these decisions about our economy, but also like medical care and resources.
Yeah, you all are really highlighting that, these systems didn't work before and they're not working even more so now. And so that you're really calling out leaders to make changes that are going to to ensure that our communities have their basic needs met, and so that they can thrive in our society. So with that said, with all the data that's available, we're seeing that COVID-19 is disproportionately affecting low-income and Black communities. What conversations or actions has that led you or your community to, or like what's that bringing up for you all?
I can go. I think something that's been on my mind a lot lately is that how people are experiencing medical racism. I think also being on social media, I've been seeing a lot more. And I guess it's been on my mind because literally I saw it last night where this young woman, this young Black woman was pregnant and she was only like 24 or 25. And she tweeted how like soon she was going to make a thread about all the times that health providers have ignored her or like not listened to her or all the inequities that exist within our healthcare system. And her friend posted a tweet a few days later saying that she passed away from complications that she's been complaining about for a while. And I don't mean to sound morbid or like bring death into this, but it's been really heavy and on my mind recently because of all the loss in the community. And this isn't a joke. Like, I feel like this is a really big deal. Like, medical racism existed before the pandemic, but this is a health pandemic. So this is the time to actually work on that, if that makes sense to a certain extent. But yeah, so medical racism is one of the big things that's been on my mind. Healthcare accessibility to people, people just being told, stay home, there's nothing wrong with you, but without even being checked up on. I get it. Like there's only like a limited supply of supplies and tools for people or like even space in the hospital. But if someone is telling you that they're sick, the least you can do is check them out. And especially since we've been knowing it disproportionately affects Black communities and women of color, specifically Black women, are the only ones that usually are turned away when it comes to healthcare issues. But on that note, again, I feel like information is very powerful, and so I've been like, my little way of like contributing has been WhatsApp. Somali community loves WhatsApp. That's their main form of communication, especially the elderly. So I've been making sure that when my mom and her friends are passing around information that is not correct about standing outside for 10 minutes and it will cure COVID-19 or something like that, I would have to like kind of like nudge her into saying like, this is not right, and then give her like some of the links that she can send to her friends, and her friends' daughters and sons can actually translate that for them, like relief packages and unemployment applications and things like that. Those resources exist. They're not in abundance, but they do exist. And it's just getting them to the people that need it. So I guess that's what me and my community have been doing, at least, to combat this, accessibility issue.
I can go. I think that, as we were saying before, it's, shed light on the fact that we were already in a crisis before the pandemic began, especially since Black and Brown people are consistently in a struggle to make a failing system work. And for me and my community, I think it's opened up a lot of conversations about how we know everyone wants to go back to normal, and that's perfectly valid. However, I think that it is harmful to think that our previous normal wasn't extraordinarily harmful to marginalized communities. And I think that it's important to acknowledge the fact that our previous normal was a shit show, excuse my language, but yeah, it was not a system that worked for certain people of certain demographics. And I think that it's important to pay attention to that aspect of it. And I'm really glad that a lot of conversations are being opened up about the highly racialized and class-based nature of the impacts of COVID, because it's really become increasingly clear to me how disposable Black and Brown bodies are to our society. And it's really sad to say, but unfortunately it is true. Another thing I feel like has not been acknowledged nearly enough is acknowledging those who are deaf, blind, and rely solely on touch for their survival, essentially. I think that it's really a perfect example of able-bodied privilege that I haven't had to think about this at all. And in reading a little bit, I've realized that this community has been pretty much ignored for a lot of this pandemic. And I think that we really need to focus on, doing things that could protect them as well. Like I've read things about clear masks so people who are hard of hearing can read people's lips and make their day-to-day life a little bit easier. So I think it's really, really, really important to include those communities when it comes to conversations on who is being impacted by COVID the most. So yeah, I think for me and my community personally, these conversations are being had. And once again, I'm glad they're being had, but it's just really sad that they have to happen in the first place.
Yeah, I think it's really wild that this is like one of the first, I don't know if it's the first time, but it's like the first time in a while that systematic racism is like, everyone's like, oh, systematic racism, here it is. And I'm like, okay, well, it's been here for a minute. And I think, I don't know, maybe there's an opportunity to start to think about these things. Maybe there's hope. But I also, yeah, we still need to start thinking about like what prevention looks like. What are leaders, what are the steps we're taking? Because it's not a one size fits all. Like able-bodiedness and being able to like wash your hands is like super real, or like stay safe is super real. If you have access to water even, or, there's like not much security around like who's gonna have their water shut off during this time. Or you live in like somewhere like Flint where there's not clean water. There's just so many facets of this, like staying at home is like a luxury. Like Black people and people of color are disproportionately like these essential workers, which a lot of people have been calling like sacrificial workers. So I think on every level, not just like the medical field, like transportation, how long does it take you to get to the nearest hospital? What are even the numbers? We don't really know. There's not a lot of like really good like data out there right now across the board, particularly for people of color. So I think a lot of people are saying there's like a silent epidemic because who are returning home and then saying they like had a heart attack when really they had COVID. So I think, I think we just need to be really vigilant about what's going on. We need like our leaders, like discrimination in like the medical field is not new. We've known about this. We know about maternal mortality rates for Black women. We know about all of this. So when like, there's like an article I read somewhere sometime, like in the last week, where they were saying how NYU, which there's like a lot of NYU hospitals in New York, sent a letter to doctors telling them to use their best judgment when giving out resources, which is just wild, because what does that mean? And of course, like using your without like, if there's no like bias training or understanding of inequality, of course those resources are going to be diverted away from really vulnerable people. So I think we just need to stay vigilant. And these are all things I'm thinking about and trying to wrap my head around. I don't have all the answers, but that's on my mind.
Yeah, I'm really hearing from you all that like communities of color have been really consistent in messaging what the issues are, and there hasn't always been action on that. And like for people who don't know what systematic racism is, for them to educate themselves, don't expect communities of color to educate them. And also like you all are making me think about like what perspective do we need to be thinking about this pandemic? Like I love the example of people who are differently abled. Like I've been recently thinking about how is this impacting people who are in domestic violence situations or who have mental health things that they're working through. So just really appreciate how you all are thinking about this and helping me to think differently. So with the end of COVID-19 being uncertain, what can people do now to advocate for change to ensure that we can address these larger social inequities that lead to disproportionate impact on low-income communities and communities of color?
Okay. I feel like I'm gonna go first. But yeah, I think we could continue to like advocate for our needs. Like y'all have said, like we continue to like reach out to our leaders and, you know, organizers. I've been on this since day one. I'm not an organizer, but I'm in community with a lot of folks, and my sister is. So I know like there are a ton of you know, webinars and conversations and like rent strikes locally that you can get involved with, and a lot of folks that are still doing that work. I think you can also just like be gentle with yourself. Like I think that's super important in this time. Like this is really hard. Take a nap. I've been taking naps during my lunch break. It's been fire. And I think one thing I've been thinking about is like, remember how quickly like our leaders can make change, even though it's not adequate. Like change has happened pretty quickly. I've been looking at a lot of like Rikers numbers for work. Rikers Island, it's a jail in New York. And within like the last 2 months, the population has dropped to almost 3,000 from like 6,000, which is like huge. And partially that's due to like crime reduction, but that's also because police have just stopped policing as much. And the fact that that's just like something that can happen, like we don't have to imprison folks, particularly pre-trial. So before they're even found guilty of a crime, 85% of people in Rikers have not even are pre-trial, are held pre-trial. So I think like there's just been so many quick movements in policy that like I never thought I'd see. And like I don't particularly think, I think we should remember that there's an ability to create quick change in the future.
Yeah, I agree with everything Emnet said. Yeah, what you talked about, police not policing enough, I feel like that's really like, it's interesting because I read an article about how basically this hands-off approach that police have been utilizing now because of COVID-19 and they don't want to get sick actually works. Like you can police people without brutalizing them. That's basically what it is. But then again, I was like, we just saw the video of like that guy being dragged off the bus for not having a mask, when in other countries they would easily just hand them a mask. But yeah, sorry, I don't know where I was going with that, but I agree. I would say social media is very powerful. That's where a lot of people have been advocating and voicing their concerns and their communities' needs on social media. And a lot of change has come from social media, especially Twitter. Oh my God. So continue utilizing that to advocate for your community. Like I know that there's a level of like not voicing their needs, or even if a lot of community members have been voicing their needs and then they don't get anything in return, they don't get their needs met, and then they get tired and frustrated, because obviously how do you continue advocating for yourself when you're basically your pleas or like your needs are just going on deaf ears and they don't do anything. So I would say yes, that's valid, and continue. Do some self-care, take care of yourself and your mental, and then jump right back into it of advocating yourself, because the work is way too important for us to leave it. If we don't advocate for ourselves, no one will advocate for us. that's like the hard lesson that everybody has to learn. Well, not everybody, those disproportionately affected by institutions have to learn. So yeah, I would say use social media, especially now that we're on lockdown. If you have access, if you have the privilege and access to Wi-Fi and internet and social media, then use that to advocate and voice your needs.
I definitely agree with both of you guys. I think that, as Iman said, social media is definitely an incredible tool and an amazing avenue for advocacy. And I think that it's really, really important that we utilize it, especially Twitter. Like, we can really do so many things with social media. And I think it's just really lucky that we have it and that we can really advocate for change through it. As I iterated before, I think that it's really important that we try our best in making sure that legislation offering relief for the pandemic, specifically in regards to housing, outlives the lockdown and gives way to more ethical and sustainable and affordable housing. I think that, yeah, I don't think that it should stop here. And why should we only be fixing a system when it completely fell through the cracks? And like it's just so revealing that the government only cares when the whole world is watching us fail. Like everything fell apart the second any pressure was applied. So I just think that now that we're getting some leeway, we really just have to completely crack down and just try our best in harassing these people in positions of power, because they're there to serve us and we should make sure they're doing their jobs. Another thing I think we could be doing is, even though I think social distancing is incredibly important, we should really stop demonizing and shaming people who have no other choice but to be outside doing their jobs. People have been edged into these positions. It's not their fault. It's a government that has decided who is worthy of wellness and health and who isn't. So I think we should not be demonizing and shaming them. And on the other side of that coin, I think it's important that we be wary of people making these folks into martyrs and creating these images of heroicism that they didn't paint for themselves and that they didn't want to be in either. I think it's really, really important that we be thankful, but just don't be weird about it, So that's my piece.
All your answers just like gave me chills. And I think one thing that you all were saying is like, this is a long-term thing. Like, take care of ourselves. Like, taking care of ourselves is a part of it, like filling ourselves up to be able to give more. And so I think that was just like so key. So how have you seen yourselves as a leader during this difficult time? Iman, do you want to start?
Yeah, sure. I feel like I'm privileged enough to work from home for two different organizations. For a magazine, Yes Magazine, they do amazing work, solutions focused. So I've been doing work with them in doing COVID-19 response and highlighting solutions in other communities that they've been doing, and it's working. So that's one part of it. And then also I work for a nonprofit called Care. And they do amazing work. They just recently released a very intensive list of resources in the city that people can access. So I've been a leader in that sense of both of them, but when it's my time off, I just show up for loved ones. I feel like self-maintenance is really key. How do you continue forward if you don't take care of yourself? I had to learn that the hard way. So when I'm not at work, I try to give it my all when I'm working, but when I'm off work, I just like sign off from news and everything. And the way that I can show up for others is to show up for myself first. So I guess like I've been checking up on loved ones and talking to friends, painting, little things here and there. And then just to make sure that I'm still okay when all this ends. Yeah.
I agree. I don't know. I still struggle with the leader thing. I think I've been a great community member. I think I've also been like treading water. like, but I feel like, yes, calling my friends and family, you know, sitting in on calls and conversations about things, you know, affecting my community and like being in conversation with folks is super important. So like, when I can wrap my head around all of this, that we can start to think about like what are solutions and what's our strategy to keeping ourselves safe and our community safe and getting freer than we were before. Hopefully we will dream this like new world into existence, because you're right, it's not going back to normal. It's like, what can we build that's better? At work, I do a lot of like tracking of like the numbers of like COVIDs, folks who have been infected with COVID-19, particularly in Rikers. Unfortunately, Rikers has like the largest growth rate in the world of COVID-19. And we know that it's like 8%. And we know that those numbers are not even really being reported correctly. There's probably a lot more people, particularly like inmates that have, people who are incarcerated that have it. So it's like, we have to, I mean, like, it's hard, but I think a lot of cities should probably look to New York as like what not to do, because folks do not need to be incarcerated at this time or at all. So yeah, I think that's what I've been doing. We've been doing a lot of like I'm a researcher. I don't know if I said that, but like, so like technical assistance to like New Jersey courts, figuring out how to like, I think before this, we were trying to help them create less burdensome systems on people. So like, and part of that was having video calls for things like probation and like monitoring and things like that. So people don't have to come in. So that really worked for this particular randomly. So everyone has video calls instead. But yeah, I don't know. I think, yeah, continuing to like be there for my people and taking care of myself is super important. So yeah.
I definitely relate to everything Emnet just said. I do feel like I've been a little bit more of a strong community member than a strong community leader. And I'm definitely working on changing that, but I feel like I've just been trying my best and posting different resources to social media, trying to advocate for change through that avenue. I've been trying to be a vessel of support for friends and family and just checking in on people. Yeah, pretty much everything you guys said about taking care of yourself and making sure you're okay when this is all said and done. You know, I've just been doing, I have schoolwork and I have work. I just go to regular work. I work at a grocery store. So I just do my day to day and try to see it through. And it's not, I don't think that I do think I can do much more. And I think that it's important that I do a little more recon when it comes to getting information for, like Iman said, with the WhatsApp resources and getting information that's correct and accurate for community members. I feel like I've fallen off the wagon a little bit with that, and I should do more to help and do more to, you know, make sure everything, or at least try to make sure most things going through are at least somewhat accurate, because I know it's a really, really large resource for communication that the Somali community uses and my family definitely relies on. So I think there's a lot of ways I can improve upon my leadership, but I'm just taking it day by day and continuing to just try to be as supportive as I can wherever I can.
Thank you all for sharing that. I feel like y'all are being super hard on yourselves. Like you're being a leader today by sharing your perspective and uplifting like the needs of our communities, and providing like ideas of how people can be engaged during this time. And like, thank you so much for showing up as your full selves when you go to work and recognizing that like you need a break and that's necessary too, when we're leaders. So I'm sending you all some love. Thank you so much for doing that. And that was incredible. And I just like am so filled up to be able to spend this time with you. So we're gonna move to the Q&A session. So I have some questions from the chat box. And if you need me to reread them, just let me know. So let's see. What are some ways, okay, what are some ways they've been doing self-care during this time? So what have you been doing for self-care? And yeah.
I think we were talking about this before, like our hobbies and stuff, but I've been trying to teach myself different little hobbies. Like I've been trying to knit more and trying to, because it's really therapeutic for me, and it's just something for your hands to do if your mind is going a little too fast. So I think it's a really nice way to just calm down and just chill with yourself for a second. So I've been trying to do that a lot. I've been reading a lot of books. I've had a lot of time to catch up on all the reading that I really haven't gotten to do for the past 6 months or so. So I've been really glad to get to catch up on that. I mean, self-care can be as simple as letting yourself watch a movie if you want to watch a movie. Like, don't beat yourself up for relaxing in this time when it's just so tense and everything is so stressful. I think it's okay to chill out. It's okay to take a break from work. It's okay to just hang out with yourself for a little bit. I think alone time is super important. So yeah, just really paying attention to what you need and how you're feeling and what your energy is and what you want to receive and what you want to give out to the world. So
Yeah, just like Nasra, I've been reading a lot. I have a really bad habit of like buying books before even finishing the ones that I have. So it's just been piling up and piling up. So I'm very grateful for that. So I've been like painting, I've been reading. I think in the beginning, I delved right into all the creative things that I've always wanted to do and I never had the time for. But to be all the way honest, recently, I just lay in bed. I'm like, if I don't feel like it, I sign off from work and I lay in bed till night. Like I don't do anything. And that's like for a while I didn't accept that as like a self-care. I would be like, oh my God, you're just wasting the day away. But now I'm like, yep, what are you looking forward to? My bed. So yeah, self-care has been like kind of a mixture of all the things like creative, painting, writing, and reading, and then also just being still, not doing anything, just laying in bed. Oh, watching TikToks too.
Yes to all of that, particularly laying in bed. Like, definitely what I did last time. Like, I have nothing to do this Friday, but I shall scroll through YouTube and chill for a minute. But yeah, I figured out we have roof access throughout this whole little shindig. So I've been doing a lot of roof activities. Yoga on the roof is fun. Coloring on the roof is also fun. Dance parties on the roof have also been fun with my roommate, not alone, but it's still fun. Yeah, so self-care.
Thank you. So the next question is, how do you think why we as an organization can support our communities right now and support systematic change?
I can go, I guess. I don't know if my answer is good enough, but I think why we always, for me at least, was a pillar for young women. It like even when I took a long break and I left throughout college and then I came back, I just always knew that it was there for me and they welcomed me back with open arms, never asking questions or anything like that, making me feel weird about leaving or anything like that. So I feel like YWE always does an amazing job of showing up for young women. Like alums are having Saturday workshops in the morning of like cooking competitions or things like that. And that is really cute. And I feel like I needed that um, on a random Saturday morning. So just showing up, I feel like they've been doing an amazing job showing up for those they care about. Um, Systematically, I don't know, but I just wanted to highlight that the work that they've already been doing and showing up for those that matter. Women are the ones that matter.
Other thoughts?
Yeah, I think like Iman said, YWE is definitely a pillar for hundreds of girls. And I think that just knowing that there are support resources available and just knowing that you can reach out and contact any mentor, volunteer, staff member, just having that information, I think does a world of difference. So I think just making sure it's well known if resources are readily available, just making sure people know that, and just making sure that it's just an accessible thing that, no matter what your your internet access looks like, no matter what your phone situation looks like, if you need to send a letter, whatever, just something to let someone know that they're not alone, because this can be a very harrowing time and a time that just really can make you feel like it's you against the world. So I just think it's really, really, really important to emphasize community support right now. Systematically, I'm not sure exactly what we could do. I think that, the fundraising is important. And I think that just trying to allocate resources and collect those resources is important. I don't know how high we can go, but we should shoot for the stars in that respect. So
I am having all these memories rush back to me right now of my years in YWE, and I just I'm so grateful to be here. I know there was such a huge amount of impact YWE has had in my life, and I think YWE should continue to do what YWE has done, because I think all of us, even on this panel, are the agents of change. We are the agents of change. We are what will change shift systems. And we're all doing really great work. And yeah, and continue to support young women, continue to be radical, and continue to build community in this really wonderful, beautiful way.
Yeah, Emnet, you hit it on the nail for me on the system part. You all right now are advocating for change. You're speaking out. I think that's what YWE does, is creates young people who become advocates for their communities. So that's beautiful. So let's see. Let me look at the questions. With the bias we're seeing from healthcare workers, how can we combat that?
I feel there's two things. It's what can you do as an individual? I hate going to the hospital. It's really not fun. I'm always fighting or having to advocate for myself, and I'm tired. If you didn't want to see me, let's reschedule, but I need you to see me as a full human. And I think if you end up having to go to the hospital during this time, I think you need to try your very best to advocate for yourself and folks in your community and your family, and make sure that you can get as best care that you can, particularly as Black people. Even if you have to sit your doctor down and be listen, you have to give me this right now, this test or whatever. I think systematically we have to push our leaders to really make sure that like our doctors and healthcare workers are aware of the biases and like that like the disproportionate impact on like people of color. So maybe there will be less bias. I think we also need to make sure that like our leaders are taking steps to make policy or like have some sort of messaging around equity during this time. And I think take care of each other. Like I've learned a lot about like different alternative health things and like elderberry and like different like holistic ways to make sure that like your immune system is like super boosted at this moment. And I think they're like, I don't know too much about it, but my roommate does, and like they are like supporting me through this. And there's like leaders, you know, wherever you are that can also help you to make sure that you're staying as healthy as you can be.
Could you repeat the question? Sorry.
Yeah, absolutely. So with the bias we're seeing from healthcare workers, how can we combat that? So kind of speaking to, I think Iman had talked about how, you know, Black women are being disproportionately experiencing bias in the healthcare system.
Definitely. I think that, like Emnet said, it's important to advocate for each other and just show up for each other when we can. Especially, you know, like if you have friends or family members that are not too proficient in English, you can help by, you know, accompanying them to the hospital and making sure that the communication is smooth and that they're not being taken advantage of by medical professionals and that they're not being undercut. So I think that on a micro level, that's something we can do individually to help boost community support and to help really make sure our communities aren't being just ravaged by the healthcare system, because that's really what happens a majority of the time. And yeah, majority Black women are disproportionately turned away and not believed and denied care. So I don't know how much power I have not being a healthcare professional and not being someone directly in the system that can advocate for change, that can really be a catalyst for change. But I think that it's important to even just talking about it can make a difference. And I think that, yeah, even though I don't have too much power in that regard, I can do my best in other ways to advocate for people that are or that can be taken advantage of by the system. And I am also one of those people. I'm a Black woman and the system doesn't care about me either. So it's just, I don't want to say it's an us against them thing, but it's really a community-based effort. And it's really something that they won't support us in this. And so we have to create our own support. And that's, I mean, it's been that way for God knows how long. So it's really nothing new. I think we just need to continue in supporting each other and advocating for one another.
Yeah, I'm gonna keep it short because they both touched on everything I wanted to say. But yeah, I would only say that we are our own biggest advocate. Trust your instinct and trust your gut. If you feel like something is not wrong, um, it's almost like a battle. Like, don't give up, keep fighting, kind of telling them, like, if you need some sort of medicine, advocate for yourself. They would try to gaslight you and gaslight your experiences and tell you that, no, I'm the professional here, and no, you don't need that. No, I know my body. Thank you very much. um, I think it's very difficult, and I understand that it's very, very difficult to keep advocating for yourself when someone who's an expert in that field is telling you you're okay, there's nothing wrong with you, but you feel all the things that are wrong with you. So I know I get it's hard. It's literally going against the stream, and it just I don't know if that's a saying. I don't know, but it's really hard, and I get it. But I said it before, and I'm gonna say it again. If you don't advocate for yourself in this cruel world, honestly, no one will advocate for you. There are amazing organizations that do, but you need to advocate for you, and advocate for the ones you love as well. So Nasra and Emnet both said that, and I just want to reiterate that.
Yeah. I'm just thinking about like in connection to career day and like how important it is to change systems, but also elevate communities of colors into positions of power and positions where they can advocate within healthcare. So yeah, that's real. So another question from the chat box was, what are some changes that you hope to see continue in the future? What does the future look like where we are all safe and prioritized?
For me, the most important aspects that I think should really outlive this pandemic: healthcare reform and housing reform. I think that those two things have really been highlighted, that like just how cracked those two systems are. And I think that there are so many people unnecessarily slipping through those cracks that is easily preventable. These are not this illness is not an ailment that is not preventable, because we've seen it prevented in people who have money, who have power, who have, you know, quote unquote merit and whatever the government sees as, you know, a strong enough currency to buy your health and to buy your wellness. And I think that it's just, I don't know. I don't know where I'm going with it, but I just think that those two are really important. And I think that the fact that this had to happen for anyone to start talking about, you know, reforming those two systems is really sad. But, you know, at least a conversation is being held, a serious conversation at that, one in which actual change can occur. And I think that this pandemic has been a nightmare for so many, but it also can be a catalyst for change. As unfortunate as that is, you know, we really live in a society where it has to be slapped in the face, sat on, shot at, and, you know, all around destroyed for it to really do anything to try to fix itself. So I think that those two are definitely, those two being reformed should definitely outlive the pandemic and the lockdown.
I definitely agree with everything Nasra said. It's also like I'm thinking back to reading this order or like this article. I don't remember what it was. It was right in the beginning of the lockdown, and where majority of the homeless community in Seattle was housed. And I was like, wait, what? So there was space for them to be housed all along. There were resources, but it was made to be a state emergency, and nothing has been done for it. But a pandemic happens and everyone is housed now. Like, it's just, so I keep thinking of the homeless community, of how, like, after this pandemic is over, are they going to be removed? And I guess this ties in with the housing reform that needs to happen, because if everything goes back to how it was before, then majority of these people are going to end up homeless again. And then the work of advocating for them, we're going to have to restart all over again. So I would believe that these systems need to be reformed and continue to stay, even though they were created in an emergency situation. These are all things that should have been done from the beginning. It's sad that it took a pandemic for it to happen. But also, on a very lighter note, hygienic practices and social distancing a little bit. If we're standing in a line in a grocery store, please don't stand too close to me. That's just to kind of make it a little lighter. But honestly, yeah, I would say those housing reforms are very, very big deal and need to continue after.
Yeah, I don't have too much more to add, but exactly what y'all said. I think this is like a catalyst for change. I said this in our run through and I still believe it. It's like, you know, transformation. I'm a Scorpio. And there's like a lot of, you know, death and rebirth in that. And I think this is like one of those moments where like things have to get really, really hard for us to like be born again or like come out of this. And like, I think it will be okay. And in fact, will be probably better. And I think there's so much we have to learn from this moment. And like, what does it mean to live in a society where people have housing and healthcare and more than a living wage, and all of those things. And I think we are getting through it. We're like a little phoenix. We'll be fine.
Thank you. So I don't think there's any other more questions, but someone commented saying, thank you for sharing with us. And that hearing you makes me recognize that I haven't been hearing many youth voices on the crisis. I also love that you're prioritizing creativity and self-care to balance the hard work of leadership. So just wanted to share that someone had said that. Nasra, do you want to say something?
No, I just thought that was really kind. I wanted to thank them. So thank you for saying that.
All right, so if there's no more questions, in closing, I just wanted to share that YWE has rapidly been changing the way that they're delivering services. So they've actually expanded the support services. So we're connecting YWE youth and families in one-on-ones and groups through daily virtual programs. Those programs are helping to fill gaps in education, in the lives of young people who are now out of school for the rest of the year. And I just wanted to shout out to our seniors graduating this year, and just we're so proud of you. And when we're able to celebrate with you, we will do so. And you know, unfortunate that you're not able to finish out the school year. YWE is also providing youth and peer mentor connections. So highlighting on those self-care strategies for physical and mental wellness. And then the program staff and our staff social worker are remotely providing COVID-19 health resources and social work services to support the mental health of YWE youth. So that looks like information about accessing basic healthcare resources. They're also supporting family members and identifying resources to help them access food and rent, utility payments, medicine, and other basic supplies. And we have a partnership with Urban Fresh Food Collective. So we're supporting efforts and providing urgently needed food boxes and food deliveries to marginalized community members. So if you're interested, you can to continue to participate in one of the many community programs that YWE offers. You can visit our website at ywe.org. And I think they're going to put that in the chat box, but it's y-we.org. And then to help us continue to provide these services, we're asking for your help in donating to our Give Big campaign. That's also going to be in the chat box. So again, I just want to thank our amazing panel of courageous leaders for sharing your perspective today and spending your Saturday with me. And we just appreciate everyone on YouTube Live for joining us. So we hope that you have a wonderful weekend. Follow us on Instagram and subscribe on our YouTube channel for future events like this. Thank you. Bye.